And welcome back. Hospitals and healthcare workers are being pushed to the max in New York as the triple-demic leads to a surge of flu, COVID, and respiratory syncytial virus cases, better known as RSV. Now, RSV is a common respiratory virus harmful to very young children, older adults, or those born preterm or with underlying lung conditions. The question is, what are the signs and symptoms that people should be aware of when it comes to RSV? We sat down with the pediatric hospitalist at the Children's Hospital at Montefiore, Dr. Alyssa Silver, to discuss more.
Thank you so much for having me.
Glad to have you. And so we're going to laugh a little bit. So when we talk about this word RSV and the RSV virus, a little hard to pronounce, but can you break that down for us? What exactly is the RSV virus?
Yes, so RSV, or the Respiratory Syncytial Virus, is a virus that is kind of like a common cold for many people. However, it does cause a lot of mucus production and some swelling in the airways. And so, especially in those who are very young, tiny babies, where those airways are very small, it causes a lot of difficulty breathing as that mucus kind of obstructs those airways, and the swelling can lead to difficulty in breathing as well. Similarly, in those who are older, have other kind of medical conditions, it can affect them as well.
When we talk about babies, we hear the babies contract this. How is it the babies go about contracting this?
So the same way as any other cold. So if you're around someone who has RSV, who might cough or sneeze, it's kind of transmitted by respiratory droplets in that way. Similarly, if you touch something that someone else has kind of just sneezed and touched something, that can also help transmit the viruses. And so when we think about babies and young children, it's very easy, especially in those who have siblings that are school aged, or or if babies are in daycare where there's a lot of learning to share, they're also sharing their viruses in that way as well.
Yeah. And so when we look at this, is this contagious?
Yes. So it can be very contagious if you're around somebody else who has the virus. And like I said, older people who are healthy, so adults or older children generally don't have a whole lot of symptoms other than maybe common cold symptoms. So it can be easily contagious if they are, near their younger baby sister or brother, and they go and give them a kiss, or just kind of cough in the area near them where they're not exhibiting a lot of symptoms in the older child, but then it can make the baby very sick. So it is very contagious. And again, because there's so much mucus production generally associated with it, any of that coughing, sneezing that goes along with those types of viruses can help transmit that.
Yeah. And so as a doctor, how do you go about treating those who are affected with this virus?
So unfortunately, we wish there's no magic medicine for RSV, and we wish there were,
Wow.
because so many babies are affected by this. It's really just what we call supportive care, or kind of helping babies through getting through the virus and getting over it until they get better. So sometimes, because they get so congested, they have difficulty feeding. And so a lot of times young babies will get dehydrated. So we often need to give them fluids or feed them, their formula through a nasogastric tube, a tube that goes from their nose down to their belly. And then other ways that we sort of help get them through this virus is by helping to get rid of some of that congestion. So helping to suction out some of the mucus from their nose. Sometimes, with all the inflammation that goes along with it, babies will also have so much inflammation in their lungs that their oxygen levels go down. So sometimes we'll need to give them oxygen. And sometimes they have so much difficulty breathing that then they need further support for their breathing. So things such as a special kind of oxygen delivery called high flow nasal cannula, where it actually gives a little bit of pressure to help babies breathe more comfortably. And kind of we can escalate from there to other types of non-invasive ventilation. And then the most extreme being when babies need to be intubated and have an endotracheal tube and a ventilator to help them breathe.
Mm, amazing. Talk to me a little bit about what you're seeing right now from your side. Are we seeing a lot of babies in your area being affected?
Yeah, we've definitely had a lot of babies hospitalized with RSV this season. I've been at the Children's Hospital for 14 years here at Montefiore, and this is definitely one of the worst seasons that we've had in terms of the number of children that are affected and hospitalized, as well as the severity of the baby's presentations to the hospital. There's probably only one other winter that was almost as bad, but I think this sort of tops it in the time that I've been here.
Yeah. As alarming as it is, I think a parent that's out there watching says, well, what can I do? How can I best serve my child in helping to prevent possibly this from occurring?
Yeah, so it's really the basic things that were extra highlighted during our times of the pandemic, where the best things you can do are good hand washing and trying not to, make sure you're not touching things that then you can contaminate and transmit the virus to your baby. Anyone with a very young baby should obviously not have them around. Newborns shouldn't be around anybody who's sick in general. It gets really hard when the person who's sick is a sibling or someone else that lives in the household, but you just try to do the best that you can to limit, coughing, sneezing, anything like that around the baby. Other things that actually help, that are not necessarily just related to transmission, but it's actually been shown that breastfeeding continues to help protect babies against more severe disease with RSV. And so even if the mom is sick, trying to limit exposure as much as you can, but actually even continuing to breastfeed is actually really good for the baby. While a mom, even if the mom has RSV or another virus, the maternal antibodies in the breast milk actually help provide some protection to the baby. And then other things like limiting, which we should always try to do, is limiting tobacco smoke exposure around young kids, because actually that exposure, which gives them difficulty breathing in general, can make it even harder for babies with RSV to breathe.
Yeah. So we've got COVID-19 out there. We've got the flu out there. We've got RSV out there. And people are not trying to navigate all three. But how do you break down the difference, or how can a person possibly potentially break down the difference between what is RSV, what is COVID-19, what is the flu?
Yeah, it actually is pretty difficult to discern some of them just with symptoms and way that babies present. So really the only way to determine is to test for which virus it is. Um, in most cases, it doesn't necessarily matter, especially for young babies, if it's a presentation of flu or COVID or RSV, because a lot of the treatment can be the same, although we know that there are certain medicines that can help treat, especially the more vulnerable who have the flu or COVID. But RSV is just kind of supporting them through it. But a lot
Yeah.
of the symptoms can overlap and be the same. So you can have fever, cough, congestion, and especially in young babies, their symptoms don't always follow the same patterns that, say, an older child or an adult might follow.
So we got the situation now where, a lot of places are mask optional. Some people we don't find wearing masks at all. And others have opted to wear. How do masks really play into all of this?
Yeah, so masks definitely would protect you from RSV, from transmitting it. It's something that overall we have to try to get past the pandemic as much as we can. But as recommended, especially for those who are particularly vulnerable, have some kind of immunocompromised state, have a young baby with them. Wearing a mask is a way to prevent transmitting many different viruses, not just RSV and COVID and the flu. So it's a situation where I would go along with using your best judgment, in terms of, especially if you're going to be in a crowded place where others might be sick and you might be on the more vulnerable population, then you might want to wear a mask.
Yeah. And so, what's the best advice that you have for parents right now, given the fact that this is out there? You're pretty busy these days, and of course, you would like to get a little vacation from this, but I know it's kind of hard. But what can you tell parents right now that would really give them some helpful advice?
Yeah, I think, trying to do the best you can with limiting exposure to people who are sick, doing good hand washing, hand sanitizers, that sort of thing. Trying to avoid being in big groups, which is, I know, really hard this time of year with all the holiday events going on. But especially if you know that somebody is sick, trying to avoid being around them if you have a young baby. And then watching out for signs and symptoms, especially in babies, that they could be progressing from what may be appearing like a common cold to more severe symptoms. So, things you can do if your baby does have a lot of congestion. So, things just like saline drops or saline spray in the nose, along with suctioning out. So, there's various different types of suction devices on the market now, in addition to the traditional bulb suction. Um, but also just kind of making sure that they're drinking really well to stay hydrated. If you notice that they're not eating great, that's okay for a couple days, but as long as they're drinking, and we like to kind of give a guideline for parents to so that they know when it looks like babies aren't drinking enough. So if it looks like, in young babies, they're going more than 6 hours to 8 hours without a wet diaper, that's a sign they might be getting dehydrated. In, babies over 1, if they're going more than 8 hours, that would be a sign that they might be getting dehydrated. So kind of looking at that to gauge, looking at how much urine they're making helps to gauge if they look like they're getting dry, and might need some extra fluids. If you notice your baby is kind of starting to breathe hard and fast, where you see their ribs going in and out or see their nostrils flaring in and out, that's a sign that something's not good and you want to bring them into the an urgent care or an emergency room.
Yeah. Long-term effects. I want to have a moment before we close to talk about the long-term effects, because many times we wonder about these things. Is there a long-term effect if a baby contracts RSV?
So the younger you are when you get RSV, so especially in the first 6 months of life, there is a slight increased risk of developing asthma later on. Same with all kids under 2, but especially the earlier on. And then that risk increases even more, especially if there are other factors that would already increase your risk of asthma. So if you have a family history of asthma, or if you have other things that tend to go along with asthma, like eczema or other allergies that tend to increase your risk, RSV may make that a little bit more likely to develop later on.
Yeah. Dr. Alyssa Silver, I want to thank you so much for taking the time and sharing with us a little bit about RSV. One more thing before we go, give us some final thoughts.
I think really I would have to say is just try your best to wash hands. Don't be around those coughing in your face. That's really the main thing. And I hope everybody stays healthy.
Yeah. Well, listen, if you want more information, thank you for joining us. First, again, thank you for joining us. I think the information is tremendously helpful. For myself, wasn't so familiar with RSV, but now I walk away with a deeper understanding and even a better way of learning how to pronounce it. So thank you so much for being with us and letting us know about RSV. But I want our viewers to know, if you want more information, please don't hesitate to visit the website, cham.org, and then follow them on Facebook at Montefiore Medical Center. We do have more show coming up. Don't go anywhere. Open continues right after this.